You are caring for a patient who is started on clindamycin, ketorolac, prednisone, lisinopril, and simvastatin. After receiving multiple doses of each of these medications, you notice that the patient's blood glucose is 205 mg per deciliter. Which of these medications is known to cause hyperglycemia? A. Ketorolac. B. Lisinopril. C. Simvastatin. D. Prednisone. E. Clindamycin. The answer is D. Prednisone. Of all the medications listed, prednisone is the only medication that is known to cause hyperglycemia. Prednisone has a number of side effects including hyperglycemia, acne, headache, restlessness, insomnia, nausea, vomiting, and weight gain, among others. Clindamycin's side effects include diarrhea, including Clostridium difficile, and less commonly nausea, vomiting, and abdominal pain, among others, but not hyperglycemia. Ketorolac's side effects include renal toxicity, tinnitus, heartburn, diarrhea, and abdominal pain, among others, but not hyperglycemia. Lisinopril's side effects include hypotension, lightheadedness, angioedema, and barky cough, among others, but not hyperglycemia. Simvastatin's side effects include muscle pains, aches, muscle weakness, and less frequently confusion, and electrolyte disturbances, but not hyperglycemia. Which of the following interventions has been shown to be effective in reducing the severity of pain in cluster headaches? A. Heel drop maneuver. B. 100% oxygen at minimum 12 liters per minute. C. Hot and cold alternating applications. D. Carotid sinus massage. The answer is B. 100% oxygen at minimum 12 liters per minute. One non-pharmaceutical intervention that has shown to provide relief for a significant number of individuals with cluster headaches is 100% oxygen, delivered via mask at a minimum of 12 liters per minute. Relief can be felt in as little as 15 minutes. None of the other interventions mentioned would be likely to improve symptoms of a cluster headache. Bell's palsy is associated with infection by which of the following pathogens? A. Epstein-Barr virus. B. Herpes simplex 1. C. Herpes zoster. D. All of these are correct. The answer is D. All of these are correct. While Bell's palsy is most frequently associated with prior infection with herpes simplex 1, it may also be associated with cytomegalovirus, Epstein-Barr virus, and herpes zoster. What is the prognosis with Bell's palsy? A. Antiviral treatment is required to prevent permanent paralysis. B. Nerve resection is required to prevent corneal abrasions. C. Corticosteroid treatment is required to prevent permanent loss of taste. D. Self-resolving in 1 to 6 months. The answer is D. Self-resolving in 1 to 6 months. In the vast majority of cases, Bell's palsy resolves within 1 to 6 months without medical intervention. Moistening of the affected eye, rather than nerve resection, is required during this period to prevent corneal damage. There is very little risk of permanent paralysis or loss of taste. All of the following are common etiologies of seizure disorders except dash. A. Marijuana use. B. Genetic predisposition. C. Infection. D. Brain tumor. The answer is A. Marijuana use. The most common causes of seizures include brain injury or tumor, genetic predisposition, medications, and infections such as meningitis. While marijuana may be a trigger for sensitive individuals with seizure disorders, it has not been known to cause seizures in a non-epileptic individual and has shown to reduce seizure incidence in some individuals with this condition when used in a medical setting.